Smile even though it's breaking. When there are clouds in the sky.
Good evening, Atlanta, and everyone who is listening to us tonight. The Health Wave on Radio Life is on the air, and I'm Victoria Barayev. Tonight I have a very special guest. I'm proud to present a dentist, a doctor who specializes in holistic dentistry, Dr. Erin, Zina Aaron. Thank you so much for being here tonight.
Thank you for having me.
The phone number in the studio is 770-727-0777. During this hour, you're welcome to call with a question, or you can write your questions directly to our Facebook page on Radio Live. We are with you during the next hour answering your questions. Dr. Erin, don't you like when people smile?
Oh, I love it. It makes you feel good.
I know, probably the whole reason why you're in business, why you're doing what you're doing.
It is. That's very true.
Absolutely. Who doesn't like happy smiles? You know, when we see someone with a happy, healthy smile, it's so contagious. We want to be in that person's space.
This is true.
Yes, yes, absolutely. It's very contagious, and we look at this person, and immediately we get. This is the first impression that a person makes on you when he smiles. It's kind of like a whole package of the personality.
So what do you see when they smile?
Exactly.
Their teeth,
so I'm leaving
right?
there. You're ahead of me. So when you smile, the first of all, we communicate through speech, right?
Correct.
So and when we talk, the first thing that we see, that people see in each other, is the face with the mouth, right?
That's true.
So teeth is number one, teeth and gums. And the way they look, teeth and gums, is sort of a representation of who you are.
Mm-hmm.
So you immediately see, I don't have to explain it to you, Dr. Erin,
Yes.
but you immediately see who this person is, how much they care about themselves, how much they care about their appearance, and truly how much of a pride they take in the way they look.
Right.
Isn't that true?
Yes, that's very true.
But at the same time, having said that, I also have to say that dentist is the most feared doctor.
Totally.
Absolutely.
Yes.
So go online and look up. You'll find so many scary jokes about dentists.
Yes.
You know, it's
We're not well liked. It's true. I hear it all the time, every day. At least one patient.
You know,
will
and
say it.
some people get that from horror stories. Some people
Movies.
Exactly.
Movies, yes.
Believe so much myth about dentistry and oral care that. So whatever the reason is, people are afraid to go to the dentist, and they put off the visit thinking, my teeth are not hurting me, so I can wait, it can wait. But when the teeth don't hurt, it doesn't mean, this is not the indicator that nothing's going on.
Exactly. Yes.
So you have to regularly go to your checkups and cleaning and everything.
Mm-hmm.
So I got so many questions from our audience, from people, and that's why I invited you, so for you to give us all the answers. Are you ready?
I'll do my best.
Great. Okay, how about smile? Smile, people. Spring is almost here.
That's true.
And I mean, we have to be happy.
Yes.
Show
and
your happy smile.
Your body releases endorphins when you smile, so it's good for overall health.
Absolutely. Yes. So how about, before we start answering all these questions, you want to play a trivia game with me?
Ooh, I love trivia.
Okay,
yes.
Great. So I got all these questions face down, right here.
Okay.
You and I take turns picking a question. It doesn't have to be in order.
Okay.
And you ask me a question, then I'll ask you a question, and we'll see who wins. I'm sure you'll win, but let's try.
Let's do it.
You go first.
Okay.
I'm gonna be brave to answer Dr. Aaron's questions.
All right. So I got the fun question first. How many teeth do chickens have?
Ho ho ho. Chickens don't have teeth.
That is correct.
Oh.
Very good. They don't. They just have the beaks. Yep.
They just have the beaks. I'm sure chickens are not the only birds that don't have teeth.
Correct. I believe. I mean, very few. Yeah, I don't think. Very few birds have teeth, really. Yes. Obviously there's fish, right? Fish don't have teeth.
Fish don't have teeth.
Ducks. I mean, there's tons of them. So.
But humans have teeth, and we have to take care of them.
That's right, we do.
Next question. True or false? Dental enamel is the hardest substance in the human body.
That is definitely true. That's one of the first things we learn.
But
in
it
dental
doesn't mean
school.
it can't crack.
Exactly, it can crack because our jaw muscles are so strong. They absolutely can crack enamel. Yes, trauma can, something cause, if you fall, and fall on your tooth, fall and hit your tooth, it can break. So yes, it's highly mineralized enamel, but enamel is very highly mineralized. A lot of minerals, a lot of calcium, phosphate, but it can definitely corrode and erode, I should say, from acids.
Mm-hmm.
Yeah.
And it probably gets affected by things like wrong nutrition.
Exactly.
Absolutely.
Sugar, excess sugar, excess acid. Yes.
So
absolutely.
anything that demineralizes the body will affect the enamel. Demineralize the enamel.
Yes. Oh yes.
Good. Your turn.
Okay. Let me get the big one here. Okay. If your tooth is accidentally knocked out, you should put it in this and get to the dentist immediately. It's multiple choice. Orange juice, milk, a damp paper towel, or pudding.
I don't know, but definitely not pudding. Orange juice.
That's
What's
correct.
the answer?
Yeah, the answer is milk based on this. I mean, it's
Really?
true. It's just, yes, you want to put it in some kind of a liquid. Milk has calcium, which is probably why they're wanting it in milk. And then you just basically have to, as soon as you can, find a dentist, get to a dentist, and they can, if it hasn't been too long, they can reimplant it into the socket.
Oh, that's good to know.
Yeah, whether it's successful or not depends on many factors, but at least that should be your first line of action.
So what about if I am a vegetarian and I don't drink milk? I won't have milk to put it in right away.
That's a good point.
That's a
I
tough
think
luck.
Saliva.
Saliva.
Yeah, spit some saliva into a little plastic bag a few times, and then put your tooth in there.
Very interesting.
Mm-hmm.
My turn.
Okay.
That's an easy one. How many teeth do adults have? I'm asking Dr. Erin.
I deal with this every day. It's 32 teeth. That's including the 4 wisdom
Good
teeth.
to know.
I got a good one for you. Why are they called wisdom teeth? Do you know?
Why are they called wisdom teeth? No, I don't know.
Okay. It's actually because they're the last teeth we get, so we should be older and wiser by the time we get them. So.
Oh, wow, great. Okay.
Yes, should be. Yes. That's we get them around late teens, early 20s.
Okay, so my question to you. Are wisdom teeth the biggest teeth in the mouth?
And they come in variable sizes. They can be smaller than molars, or than first and second molars. They can be larger. There's no. They're very varied in anatomy.
Oh,
So,
okay, good to know.
yeah.
Because I read that molars are the biggest teeth in the mouth.
They're not necessarily.
necessarily.
No, I've seen them be
Okay.
smaller. Yeah.
Your
First
turn?
and second molars, yes, they're the biggest one is, I believe, the first molar. It has 5 cusps. The other ones have 4 or less. All right, my turn. Oh, the first toothbrush with bristles was made in what country? Another multiple choice. Denmark, China, Egypt, or the U.S.?
Interesting, but I know the answer. China.
That is correct. You remember
Yay.
what century around?
What century? That I would not know.
Okay, 1498.
Very
So,
interesting.
Yeah, it's been
Okay.
a while. Yeah,
It's
an
that
actual.
old.
Yeah.
My turn?
Mm-hmm.
How long should you brush your teeth for? 5 minutes, 1 minute, or 2 minutes?
Yeah, so the standard accepted, standard level of care is we recommend 2 minutes. So 1 minute per arch. 1 minute for the top, 1 minute for the bottom.
Okay, good to know. There is a joke that there are 2 kinds of people. Those that brush their teeth in front of the mirror and those that take a 4-minute tour around their house.
I do know that.
But you know what? On the average, on the average, people in America take 45 seconds to brush their teeth.
Mm-hmm.
Is that correct?
Yes, we live in such a hurried,
Exactly.
fast-paced society that, we
So
don't
it's
have time.
probably better to take a tour while you're brushing your teeth. At
That's
least you'll take your time brushing your teeth, very, very
thoroughly. Yes. Yeah, and I've actually recently read that there's an app for kids when you're trying to get them to brush for a long time. There's an app that some entertaining little thing that they do for 2 minutes to keep the kids engaged so they can learn to brush for 2 minutes.
Oh,
So,
interesting.
yeah.
By the way, is it a good idea to brush your teeth for longer than 2 minutes? Like 4 minutes? While you're taking your tour?
I would guess I don't think there's any harm in that. You just have to brush the right way and be careful.
So there is no
Yeah,
harm to it.
I don't think so, no. I mean, you have to use solid bristle toothbrush. That's number one. Electric toothbrushes are, becoming very popular now and not so expensive. So if you can invest in one of those, and just you'll know. So 2 minutes is for sure. You want to try to do that as minimum.
Great. So your turn.
All right. Oh, this is perfect lead-in. True or false? The best way to clean your teeth is to use up and down or side-to-side motion.
Up and down or side-to-side motion. All of them.
Okay. If you combine it, it ends up being in a circle,
In a
and that is
circle.
the best way. Yes.
Okay.
So you want to do a circular motion, and you want to get up to the gum line, because you need to stimulate and massage the gum so the blood flow can increase, and that way you can kind of get the tooth and the gum at the same time
Exactly. So in a circle for 2 minutes.
for 2 minutes.
Okay,
Mhm.
so learning something. My turn. Can chewing gum help prevent cavities? What kind of a question is that?
Well, so it depends on what kind of gum, right? If you got gum that's filled with sugar and you're constantly chewing on it, no, that would hurt you rather than help you. So, but there are gums out there now with xylitol. Xylitol is an ingredient that can that's something that is not harmful, and it actually can help you. So
I would probably argue on that, because xylitol, it's a sugar substitute. I wouldn't prefer to use anything with a sugar substitute, especially. Plus the gum itself, putting rubber in my mouth, I'm against it.
hey, I don't even know if there are any studies done on this. This would be interesting. Now you're giving me homework to look up, so
Okay,
I'm gonna
great.
have to write that down and get
Please
back
get
to
back
the
to
viewers.
me on
Yes.
Get back to the viewers.
Yes.
Oh, your turn.
Okay. Oh, this is the same, kind of similar. True or false? Brushing too much can harm your gums.
So we already answered that one.
Correct. Yeah.
Okay, then I'll take my turn. True or false? While regular sodas damage teeth, diet sodas do not. I want to answer
my
that.
favorite one. Go ahead, answer it.
No, you answer it.
Yeah, there is that misconception. I have patients who are like, oh, but I drink diet soda. Still, soda is acidic, and
Exactly.
it's very addictive, unfortunately. So, I actually have patients with a cavity on every single tooth in their mouth. Young patients, 18, 19, 20. I'm like, what are you doing? Why? And he's like, oh, I'm drinking Diet Coke, or I'm drinking Diet Sprite, and I'm like, that's part of what is causing that acid erosion. So it's the sugar, it's the acid, and the enamel suffers. So,
Dear friends, stay away from diet soda, for sure.
yeah, soda,
Your
period.
turn. Soda, period.
All right. Oh, these are the largest teeth: incisors, molars, or wisdom teeth.
So what we just answered that. So it could be wisdom teeth or molars.
Yeah. So molars, those are the teeth we use for grinding and chewing our food. So they've
Great.
got to be wide and have a large surface area for that.
Last question. To brush your teeth effectively, you should hold your brush at this angle. Select one. 90 degrees, 45 degrees, 100 degrees.
Yeah. This is called the modified Bass technique. This is what we were taught in dental school. So the toothbrush should be angled 45 degrees down into the gum pocket in order to actually reach down into the pocket, because that's where the harmful bacteria is hiding. So you should, on the top arch, you should angle it up 45 degrees. On the bottom, angle it down 45 degrees.
What do you mean? How do you do 45 degrees?
So it's right in the middle between horizontal and vertical. So just tilt it up a little bit, and then on the bottom,
relatively
down
to
a
your
bit.
teeth, right? 45 degrees.
relative to this way, to the horizontal plane.
I see,
yes,
to the
yes.
horizontal
Mhm.
plane.
Mm-hmm.
Great. So, Dr. Aaron, why holistic dentistry?
Okay, so I've been in practice for almost 11 years. Started out, went to dental school here in Augusta, conventional dentistry, and found it, very interesting in general. And I've practiced pretty much, up and down the East Coast and in Miami, New York, and all of that. And so holistic has become a passion of mine for several reasons. But, I have some loved ones who went through some health issues. And then what I see in practice every day is there's just patients really believe that there's some magic separation between the mouth, the oral cavity, and the rest of the body, which is just very untrue. The mouth and the body are connected. And so holistic dentistry at its core that's what it's based on, the oral systemic connection. So that whatever happens in the body affects the rest of the body and vice versa. So there's some statistic that says up to 80% of diseases either manifest themselves or start in the mouth. So, in dental school, clinically, I learned a lot about how to manage disease, meaning you have, patients that come in, they have a cavity, I know what to do, I fill it. If the teeth are crooked, we straighten them. If a tooth is broken or deeply decayed, root canal it, put a crown on it. Mm-hmm. So while this is all useful and necessary, we also need to look into the whys of all this. So I can keep fixing your cavities, but if you keep getting them over and over again, then there's something we're missing. So also there's a big link in the last about 5 to 10 years. Lots of studies have come out that link periodontal disease, which is a disease of the gums and the bone that hold your teeth in place, mm-hmm. and heart disease, stroke, diabetes, autoimmune diseases, and so on. So the same bacteria, the same harmful bacteria that are found in our gum pockets, if you're brushing at home and all of a sudden you spit and you see blood, in the sink, that's bad. That's a bad sign. So that's not normal, So the same bacteria is what's been found in people who have strokes, who have heart attacks. And so this just basically means one thing, that the body is connected, that the mouth and the rest of the body there is a connection, and we need to focus on this. So, and I think that medical doctors need to place more importance on having their patients go visit their dentist, because again, if you have periodontal disease, your heart is going to suffer. It's a fact. You can Google it, research it, whatever.
Very
it's there.
Fascinating.
Yes. So, most MDs have maybe 1 or 2 lectures on dentistry. Oh, the patient has 32 teeth. If it hurts, go send them to the dentist.
Just like nutrition.
Yeah, exactly. Yes. So I think we badly need to bridge that gap between dental and systemic, and holistic dentistry is one of those ways. So.
Well, definitely, you can't argue with the fact that everything in the human body is interconnected.
Right.
You cannot look at the teeth and not look at the rest of the body. Right.
But that's
and vice versa.
Yeah. But sadly, this is what people think. They come in, they're like, oh, it's just my teeth. I'm gonna put it off. I'm gonna, it's not hurting. So, but you don't know what pain is usually one of the last symptoms. Something's been going on to lead to pain for years, and we need to investigate that. So this is what, yes, it's good to go when something hurts, but you definitely don't want to get to that point.
Absolutely.
So, yeah.
Well, talking about holistic dentistry, we can't not mention the name of the dentist, Weston Price, right? Who really believed in the connection between the human health, physical health, nutrition, and dental health, right? So he really he really did a lot of investigation, a lot of studies, and he influenced. I believe he even influenced the modern dentistry. How did he influence the modern dentistry?
Well, he was a dentist, yes, and he actually basically he decided to take some time off and go travel to indigenous countries and, investigate why those people, or what kind of dentition they had, and what made that different than what he had, because he was starting to see a lot of decay all of a sudden in his population. So, so what he saw was, they didn't own toothbrushes, they didn't own, hey, I need to go to my dentist. They didn't have dentists, so, but they had healthy teeth that had wide arches. They didn't have crowding. They held all 32 teeth in their jaw.
What is crowding?
Crowding is when there's not enough space in the jaw to accommodate all your teeth. So they start shifting and turning to find that room.
So that's why everyone gets braces nowadays.
Correct.
Almost
yes.
everyone.
Mm-hmm. Yes.
And that has to do, Weston Price believed that had to do with nutrition, correct?
Correct. Yes. So that's what he found. He found that the kinds of foods they ate affected how their jaws grew. So that's what this is what he was looking at. So he discovered what's called the concept of nutritional injury, that if we have the nutrition we're supposed to have, our bodies grow straight and strong, our teeth grow straight and strong. We have no modern diseases like heart attacks and strokes and diabetes and cancer. So we find now that our bodies are falling apart because our nutrition has fallen apart, and the basic tenets of his discoveries were that societies who lived longer and healthier lives had 5 to 6 things in common. That they ate diets that were very low in sugar.
Exactly.
Even honey and maple syrup that was not, it was more like a treat. It wasn't something
sweeteners.
Correct.
Added sweeteners.
Yep. That nothing was processed. Everything was local, organic. They ate from the ground, sustainable, because they didn't know any other way. This is just how it was. That they ate a lot of mineral-rich bone broths. Mm-hmm. So. They were really what we call snout to tail societies. They didn't waste anything of the animal, not even the bones.
Wow.
They cooked the bones along with, the meat and the muscle. So, and then they also ate a lot of saturated fats from pastured animals. So the omega fatty acids were balanced. Nothing was grain fed or in feedlots. Their animals were local, humanely raised, because again, they didn't have any other way. And they respected where their food came from. Then societies that had cattle or goats drank raw, unpasteurized milk, which offered a ton of probiotics and gut healing benefits. And of course, they ate a lot of lacto-fermented foods. So kefir, kombucha, yogurt, sauerkraut, and pickles. They're made in brines rather than vinegar. Mm-hmm. So that, again, the process produced a lot of probiotics in that way. So... it's like this is what we should try to do.
So sugar is not the only culprit, right? So when we talk about nutrition, it's more processed foods.
Yes.
Right.
Yeah. Those societies didn't need that food. It's when apparently the missionaries came into those that they brought in this kind of food that he started seeing deterioration in the dentition. Exactly. Yeah.
So when we talk about teeth crowding, right? I understand that this must be due to some sort of deficiency.
It is. It's a deficiency in jaw growth. Like it's not growing. It's not growing into how many teeth you're supposed to have. Mm-hmm. It's not, so it is, it's the, right now we're having, we're eating a lot more soft diets as well. Mm-hmm. So the jaw is not getting enough exercise, if you will, like they did, back then. And again, processed foods are softer, right? Than fruits and vegetables, right? Mm-hmm. That are crunchy. Right. Okay. That makes a difference. Cookie, a lot softer than a carrot or
so we're
celery.
Not exercising our teeth.
Correct. Properly. And of course, a lot of it I think is from what I've read before. All this starts in utero. What your mama ate.
Oh yes.
During pregnancy.
We've talked about it many times here.
What your mom eats. How the development starts really shortly after conception. So
exactly. Even before.
Yeah. So that's true. Even before. So that part is not your fault per se, but if you're going to have children, keep that in mind. So
exactly.
That what you eat and how you take care of yourself will affect your offspring.
And I wanted to remind to everyone here tonight that our guest is Dr. Zina Aaron. Dr. Aaron's practice is located in Atlanta, Georgia. And where is it exactly?
In Tucker.
In Tucker.
Yeah.
The name of the practice is Rose Dentistry.
Rose Dental, yes.
Rose
it's named
Dental.
after, yes, it's after my daughter's middle name. So,
Oh, very beautiful.
Yeah.
The phone number is 678-329-9776. Is that correct?
no.
No. Wow. This
That's okay.
is what's
I'll
on
give
your
you-
website.
Well, there's several numbers, so I can give another number. That's fine.
Please say your number. Please say your
678-528-6747. Yeah, there's several numbers, so this might be one.
Okay,
that gets her.
678-528-6747.
6747. Yes.
6747. Please call Dr. Aaron to make an appointment. And I'm back to my questions.
Yes.
Dr. Aaron, please explain to us how is holistic dentistry different from regular dentistry in terms of your methods of use, and what do you do differently?
Sure. So holistic dentistry to me is just a more custom-based approach to dental and overall health. So we take into account the patient's overall status, their genetics, and their lifestyle when we treat them. So sometimes, like something like, for example, during a new patient appointment, we could test your salivary pH to see how acidic you are, and then recommend nutrition counseling. So like something like, you've got to eat more alkaline foods. Alkaline diet is very important. So then supplementation is also something that we can recommend based on whatever it is you're deficient in. And that's, of course, done after certain types of testing that we can talk about later. We also perform something called a biocompatibility test. So we work with a lab that does a blood panel that tests for all the dental materials we use in the office, because anything I place in your mouth, that's what you're going to have. Like, this is going to become a part of your body. So we determine, that helps us determine whether the materials we're using are compatible with your own body. So I might be allergic to something, you probably are not. So we need to tailor that a little better, right? So if let's say you need to get dentures, and we know what we're using in dentures, we're going to test you to see if that's something that you're going to be just fine with, So
there is a spectrum of choice of different materials that you can choose from?
Yes, there is, yeah. And different brands of composite, let's say, which is the white tooth-colored filling material. There's different kinds of crowns. I mean, there's just a whole variety of, thousands of materials we use that we can test and see if you're highly reactive, neutral, not reactive, whatever it may be. So it's a spectrum too.
And this is something that's not done in the conventional dentistry?
No, not that I know of.
You don't get
I've
much
never,
choice?
Right, it's whatever the dentist has at the office.
So it probably leads immediately to the question of amalgam fillings, right?
Amalgam fillings, yeah. So, right, so part of what holistic dentistry is that we consider amalgam to not be safe. Like, conventional dentistry considers it to be fine. Amalgam, by definition, means a mixture of something, right? So it's a mixture of 55% mercury, 9%, anyway, it's 9% of, I believe it's silver, yes, and then a certain percentage of tin and so on. So it's metals, and, like if you, let's say, you're at a school and you break a, pencil size of mercury or a thermometer or whatever.
Thermometer.
Yes, thermometer.
The big one.
Yeah, you break it. What happens? You got to bring in a hazmat team. Yes, and so, but then somehow it's supposed to just be safe in our mouth. So we kind of question that, and some people also just have problems eliminating or excreting, heavy metal, like they have heavy metal toxicity is what we call it. Some people are fine with it. Other people have problems with it,
Many people have health issues, and it goes on for some time before we realize that this is what the cause is.
Right. Or at least there's definitely a correlation. I have patients now, they're like, just recently I had a new patient. She was like, I had my silver fillings removed. And 2 weeks later, I felt, the fatigue was gone, the ringing in my ears was gone, so she said, and before that she's been to like tons of doctors, couldn't figure out what the problem was. So she said, then she started doing research, just, she's like hours of research, and then she realized, yes, I had silver fillings in my mouth. Everything else was okay, so what could it be,
I also have quite a few clients that, had the same issue.
Yep.
And everything started to get better as soon as they got this removed.
Right. The other thing too is the method of removal, right? That's also a big one, because the biggest the most dangerous, kind of the most mercury vapor release is when you place an amalgam and when you remove it. So if you don't remove them properly, then you're getting exposed to that mercury vapor. So part of being a holistic dentist, is using a certain protocol that the IAOMT, which is American Academy of Oral and Medical Toxicology, they have a protocol that you're supposed to use, and that involves draping the patient fully, using a rubber dam, using high-speed evacuation system, suction, maybe even vitamin C beforehand for the patient. And for me, as somebody who's constantly removing these, I need to protect myself as well and my staff.
Correct.
So we wear like these Darth Vader masks, as people call them, masks to help us filter out all this vapor. And then got to open the windows, make sure that we have a mercury separator. So now even the government is mandating us to have a mercury separator so it doesn't get into the environment. So it's like they already know. It's like something like, they know that it is toxic in the environment, but again, in our teeth, it's supposed to be okay. So this is something, again, nowadays with the internet, people are starting to do more research and are able to think for themselves a little more.
So this leads me to the next question. What about when you compare this kind of danger, right, toxicity from amalgam fillings, and danger from taking or getting x-rays? Let's say so many people, health conscious people, just go to the dentist and say, I don't want my teeth to be x-rayed. I don't want to get exposed. So what's worse?
So, radiation it's all around us. There's no way we can escape it. I mean, if you're using a cell phone, that's radiation. If you're, flying in an airplane, that's radiation. If you're going outside, like in the sun, that's radiation, So, but it's like, would you ever take your car to a mechanic and be like, hey, can you fix this? But wait, you can't open the hood. That's a little weird, right? So you do want to at least once a year. Again, if you're high risk, once a year, meaning if I see cavities in your whole, mouth, I'm going to insist on, we need to see what's going on. And also, again, you might not have pain now, but you might have a cavity that's starting out, and you will never know this. It's not easy to see small cavity. You can't see a cavity that's just starting out with the naked eye.
X-ray will show.
Yes, only X-ray will show. There are some things you can do to help yourself prepare for it, though, for dental X-rays. And one of those things is like to load up on antioxidant foods right before, because they'll gobble up all those free radicals that happen. Also, seek a dentist who's using digital X-rays, because they have a lot less output than traditional film one. Yeah, about 1/3 of the output of a regular X-ray. So digital is really it's more like taking like a picture rather than an X-ray. So with digital, so that helps a lot.
There is a joke. A patient comes to the dentist and says, "Oh, please don't take X-ray on my teeth." And then dentist says, "Oh, okay, just let me scrape all this microwave popcorn from the back of your gums first."
There you go. Exactly. That's right. Microwave. That's another one.
That's another one.
That's very true.
Used regularly.
It's all around us. So also though, with holistic dentistry, there are like these little pellets that we use, like homeopathic type things that I'll have you take 3 right before we take X-rays. So they'll help you also to kind of neutralize that radiation. So I think it's a risk versus benefit thing. I mean, I'd rather, you know, if you would go to a medical doctor and they said, hey, we need a chest x-ray, would you say, no, don't do it? No, we've got to do it because we need to see what's inside. You know, it's like, do you want x-rays or do you want, like, you know, an extraction of a tooth or a root canal or something worse? I mean, you know what I mean? So I think x-ray is a very small trade-off for, yeah.
You know, I have to ask you a very controversial question. Holistic dentistry is being criticized by the conventional one for a couple of reasons. Number one reason is that, you know, the use of all this natural recommendation of all these natural ways of dealing with health, like craniosacral, like homeopathy and so on. So do you use these sort of methods? Do you recommend them, and do you find them effective?
So a lot of the patients who come to me who are holistic, they are already working with a naturopath, you know, and so they're already. I'm not going to stand in their way. I'm not one of those. I feel like if it's not going to hurt you, it you know, it can help. Do it. You know, I'm not going to say, you know, that this is weird, you shouldn't do it. No.
Gimmick
no, I don't think so, because I think Western medicine doesn't have all the answers, and, you know, Eastern medicine probably doesn't either. So it's the best way to, it's best to combine them, use the best of both worlds, because there's a place for both of them. You just can't ignore one fully, you know, and just say, oh,
I agree with you.
The science is, you know, settled. No, it's not settled. It's never settled. Like, what if the people who thought the earth was flat said, oh, science is settled, we're done? I mean, what would happen then? You know, we're constantly evolving, we're constantly learning. So and that's why God gave us a brain, so I think we need to use it.
Yeah, that makes sense. That exactly makes sense. But also in the conventional dentistry, they believe that holistic dentistry is more expensive. You'll go there and you'll spend more money. So how do you overcome this
That's true. Yes, so that is a misconception. I mean, I think it really all depends. And you got to think, okay, expensive compared to what? I mean, this is your overall health we're talking about. It's not just teeth. So we need to get away from that paradigm thinking, oh, it's just teeth. No, this is your overall health, right? So it's like you either pay now to keep it, or you pay later when you're sick.
Well, some things are probably covered by insurance still.
Yeah, so I mean, if your practitioner is in network with insurance, with insurances, you know, then we've pledged to charge this certain amount for, you know, for a filling. But things like the safe amalgam removal, which is called the SMART protocol, they don't even know what that is, so they don't cover that. So yeah, and since it's more time, more materials, more equipment I have to use, I do have to charge for that, you know. But overall, this is, and again, if you're regular about visiting the dentist, if you're doing what you're supposed to do at home, we can head off a lot of those problems, so you don't have to spend that much, you know. You can, if we're keeping up with it, you know, you're getting cavities, we could do a couple of fillings, counsel you on, you know, and that's a lot cheaper than having to go down that rabbit hole of root canal. Then root canal fails, you get an extraction. Then extraction, you know, then you're going to need to replace it somehow. So you get to do a bridge or an implant or something. So it's a lot cheaper if you keep up with it than if you neglect it, and then it becomes, you know, $5,000-$10,000 worth of treatment, and insurance covers $1,500. So now you're like, oh my God, it's so expensive. Yeah, but you haven't gone for like 5-10 years. You know, like, what do you expect? Something's got to give, you know?
You know, two big questions is about gum disease, such a widespread disease, and also root canal. So I want to know, how does holistic dentistry view these two problems?
Okay. Gum disease. So that's what we call periodontal disease. Again, so your teeth sit in bone and surrounded by soft tissue, which is the gum, right? So what happens with periodontal disease is that the pockets in your gums have gotten so deep at this point that bacteria is basically causing you to lose the bone. The bacteria is just causing bone loss. It produces toxins that destroy the bone. So, you know, if you go to the dentist, they're going to do probings around your teeth. We're calling periocharting. So it's a six point probing around each single tooth. So if you're hearing numbers like 1, 2, 3,
Right.
4, 5, 6, whatever, right? So I always tell the patient before I start, look, we're looking for numbers 3 or less. 3 or less is good. That
Well,
means
then you hear
clinically.
5, 6, 7,
Yeah,
8, 9, 10.
So yes, and I say these numbers out loud because they need to see, they need to hear what it is that's going on. So then also take photos, So I'm like, look, I'm probing this. You've got blood coming out of that pocket. That's already a pocket that's 4, 5, 6 and above, right? So the
And at
shallower
that
the
point,
pocket,
you may not treat it holistically, right? So you
well,
have
we
to-
can. So conventional dentistry, they would do the deep cleaning. It's called the SRP, scaling root planing, which we would do also in holistic dentistry. That's basically mechanical removal of all that crud that's underneath, that's inside that pocket that you can't reach yourself, no
In
matter
other
how much
words,
you floss.
surgery.
No, it is not
Still
surgery.
not surgery.
It's instrumentation with our instruments, special instruments that we go down that pocket and we remove. So sometimes when you don't floss, and you can't get to the bottom of the pocket. So physically, we're only able to go 3 millimeters down with our toothbrush and our floss. You have a 4 or 5 millimeter pocket, you're not getting to the bottom of it, no matter how much you try, right? So you're starting to get some pain in your gums, and you're like, oh, I'm going to start flossing. Okay, you start flossing. But you already got 4 or 5 millimeter pockets. You're not doing any good. You're just kind of cleaning. It's like a 6-foot trash can, and you're cleaning the top 3, and you're calling it clean, right? So, exactly. So we've got to go with our instruments down to those down into those pockets, and you might also have what we call tartar, which is stuck on, basically plaque that hasn't been removed. It's become calcified. So we've got to remove that. And what happens then if we do it right?
Something that's being removed with an
instrument.
With an
instrument. We don't, and we get you known for that, So we remove that, and what happens then is, like, if the pocket was this wide, we clean this, or this deep. We clean this the bottom of it. The gum sticks back onto the tooth. So a 4 millimeter or 5 millimeter pocket becomes a 2 or 3 millimeter pocket, and at that point you can clean it at home all day long. So that's the goal, is to get it to where you can clean it at home and be effective, right? So, but sometimes too, back to the question, with conventional dentistry, what they're gonna do is tell you about, like, hey, we can put an antibiotic little chip. It's either perio chip, which is actually chlorhexidine. It's not necessarily antibiotic, it's antimicrobial, or a Weston, which is an antibiotic, down into that pocket, and that basically blasts all the good and the bad bacteria, right?
So you would
that's
still
what
use
antibiotics.
antibiotics?
No, this is traditional dentistry.
This is traditional
yes.
dentistry.
And then, you would come back, we would reprobe, great, but then what happens with that is it does revert back. The condition does recur again. But in holistic dentistry, what we use is ozone therapy. So ozone is a gas, O3, right? So it's an extra oxygen. So it's made from medical grade oxygen. And there's a therapeutic dose that we put into those pockets, and ozone basically kills just the harmful bacteria. Because with bacteria, a lot of times bad bacteria, what they'll do is form a biofilm, which is like a thick gelatinous layer, and an antibiotic can't even penetrate that. But the gas, ozone gas, will go right through and kill that bacteria.
Oh, very harmless.
Exactly.
There's no
So,
antibiotic component.
Exactly.
Or anything?
And it decreases that whole resistance to antibiotics.
Very clever.
The epidemic we're having right now with resistance to antibiotics. So that, and then, ozone's actually used a lot in
where else?
Holistic dentistry. It's also used with, if you have a deep cavity, let's say, right, and I'm very, very close to the nerve, right? The nerve is the center of the tooth. Instead of like getting super close or exposing the nerve, we stop right short. We add a little bit of that gas that kills the bacteria that's right close to there, and then we fill it. So it helps also with some nerve regeneration, possibly. So post-op sensitivity tends to decrease. So, and also we use it after an extraction. We take a tooth out. There's an infection in the bone usually. So how do besides scraping it out, which you could do forever and still keep it, still have the infection trapped.
Normally you would be prescribed antibiotics.
Correct. Afterwards, you could be, or again, the doctor, the dentist would like scrape the, there's maybe a cyst or whatever, but instead we do that, yes, but we also do ozone to kill any of the bacteria, the harmful bacteria that's in there. So
Very interesting.
yeah. So
What about root canals?
yeah, root canal is definitely a controversial topic. We're taught in dental school, you got a deep cavity, you expose the nerve, and we know we expose it when we see bleeding in the center of the tooth, because a tooth is actually its own organ. It has its own innervation, its own nerve, has its own blood supply, has its own 3 different types of tissue. So it's definitely an organ. So basically it's 32 extra
32
organs.
organs.
That's right. So, and so now that the bacteria has invaded that nerve, that's why you're feeling pain, right? Because the nerve is now infected. The pulp is infected. And now it's like, okay, it's either we remove the tooth or we remove the nerve, and you get to keep your tooth. Okay? So the controversy is that
whether to do it or not.
No, well, so if we do, let's say we go with the root canal. The tooth has vertical roots, right? Vertical canals with the nerve going through them, right? But also there are canals that are going horizontally too, that are accessory canals, and those are really impossible to clean. The whole thing is like how the controversy in that it is impossible to fully sterilize or fully disinfect an infected tooth, even if we do use all our cleaning agents. Definitely ozone helps. Sometimes holistic practitioners would use ozone inside the canal, but is it like a absolute? No. So that's the whole thing, is like we can't fully ever clean it out, so the infection might be there even though we don't feel it, we don't know it. So, and ultimately, like if let's say at some point our immune system is suffering or whatever, at that point it can flare up, and then you're like, oh my gosh, and then root canal can get reinfected. So then you go back, it's like, oh, what do I do? You can either get it retreated or pulled, so it's like,
right, sometimes you don't have a choice.
Yeah, so the best is, not to even go there and just get your checkups so you don't have to deal with something like this, but yeah, so that, and then also that teeth there's a tooth body meridian chart if you look it up online. So it is purported that each tooth is connected to a certain organ in our body. It sits
on the meridian.
It sits on the meridian, exactly. So if a tooth is root canaled, it blocks that meridian, or it disconnects from that, and so your body can't heal, itself in that area. So there have been many reports of people like removing their root canal teeth and feeling better about some chronic thing goes away.
Personally, I've known people like that too.
Oh, there you go. So yeah, so it's like when you can't find the answer to like what's going on, look inside your mouth.
Dr. Aaron, we talked a lot about how to brush our teeth. Well, let's get to the more practical part of our oral care, things that people deal with on a day-to-day basis. What kind of a toothpaste do you recommend?
Okay, so toothpaste. Basically, there are various brands out there nowadays, but you kind of want to look for something that, for holistic people who come into my practice, they know fluoride free,
Yes. So you do say fluoride free.
Yes. I mean, fluoride that's another controversial topic, right?
It is.
So we're being told that, fluoride is good for you, or at least it can help reduce decay in your teeth. But there are studies that have been done that consider fluoride a neurotoxin. So there are studies on PubMed that you could look up that say that it can lower IQs of children.
So that's why we're so panically afraid of fluoride, and we get fluoride-free toothpaste.
Yeah, so like if you look at like a regular toothpaste, if you look at the label on it, it cautions you against swallowing fluoride. It says, hey, keep out of reach of children, do not swallow. Adults and children 2 years of age, or children under 2 years of age or under, very, very small pea-sized amount, because there is fluoride is, again, it's all about the dosage. It's a lot less, of course, fluoride in our toothpaste. In our toothpaste than something that could damage you, but the effects of fluoride accumulates in the body.
Exactly.
It passes the blood-brain barrier too. So that's part of what the lowering of IQ is probably.
There's only that much that you can have.
Yes.
You can
so
afford.
yeah, and so and then you get the fluoride application in a regular office. But yes, it's topical. It is less dangerous than ingested fluoride, but they apply it onto your teeth topically. But can you really prevent? Yeah, can you really prevent from swallowing it? Probably not. So
it's best to avoid it, you would say.
Yeah, and there's some information here I have that fluoride molecule is smaller than water and can be absorbed through the gums and enter the bloodstream. And the area under your tongue is actually one of the most sensitive areas for nutrient absorption. And you just put like a little so it gets right into your bloodstream. A
lot of supplements or drops we put under the tongue because it gets absorbed faster.
Exactly, that's true. So, but fluoride is routinely added to our drinking water. So you're like, oh, but I only drink filtered water. Okay, but like you go to Starbucks and you get, a coffee. They're using They're using, water that's, tap water, let's say, for instance, or it's really everywhere now. Concentrate, juice concentrate.
Right.
There's a lot of
things are out of our control. But if we can control something, then we should do it.
That's true.
Right?
That is true. Yes, but you can also get like a whole house filter that filters out fluoride. If it's really that important to you. We do have that at my house. So it's like if a tiny amount of toothpaste can be swallowed without calling poison control, like what it says on the tube, why is it safe to drink fluoride in our water? And apparently, the fluoride is not approved by the FDA. It's not a nutrient. It's classified by the FDA alongside lead and mercury as a xenobiotic, which is a foreign chemical substance. So, it's actually the only medication given to the public without our consent.
Wow.
So, yeah. And it's used in like a couple of other, did some research. It's apparently used in Prozac, in sarin nerve gas, in Rohypnol, which is the date rape drug. So, again, I'm all about like, hey, it's about the dosage, right? Even water can be toxic if you drink too much,
Absolutely.
right? But with fluoride, since it accumulates, how do they know how much water how does the government know how much water we drink, So how do they know how much toothpaste, So it's just something just to be aware of, it's not like tomorrow's going to kill you, but, if you have choices to make, and if you can make choices, then you can do that.
So the amounts matter. Basically, anything in excess can harm our body.
Exactly, anything, yes.
Too much of a good nutrient too.
Exactly.
Even just too much food can hurt us.
Oh, totally.
Even healthy food. Too much healthy food can hurt us.
Oh yeah, I used to eat salads and I gained weight. So yeah.
Absolutely. So there's another ingredient that especially health-conscious people are very cautious of. That everybody knows, sodium lauryl sulfate, to be afraid of. Not to check your labels when you buy a shampoo, check your labels when you buy toothpaste. Can you comment on that one?
I think SLS if I'm not mistaken, it is like a foaming agent, I believe. So it just makes your toothpaste bubble up and feel like you're getting a good clean. Is it really necessary? No, not really. So if it's something, and I think it's like a poison, right? Correct. I think it's been also termed as a poison. So it's not necessary. I mean, again, just because you're going to use it doesn't mean it's going to like kill you, but it's just better to not have something that's not necessary, right? You can use toothpaste without it and feel just fine and do just fine. So flossing is a big one. Really, like people, if you brush but you don't floss, you're missing.
So many people think, I think it's also a myth, people know that in a week I have a dental appointment, so 1 week before you go to the dentist you start flossing your teeth. So do people really trick dentists like that? So the dentist, he can see,
Oh, yeah.
right?
Oh,
He
yeah.
can definitely. You cannot trick a dentist
No,
by,
no, we can see it because
making
the gums.
him think.
Yeah, because if you haven't flossed in forever, your gums are gonna be puffy. You're gonna have that bleeding in there,
And it takes
even
longer
if you
than a
do,
week.
oh
to,
yeah, it takes longer
to
than a
get
week,
that.
of course. And again, like I said, if you have those 4, 5, 6 millimeter pockets, you can floss all you want, but you're not getting to the bottom of those.
Mm-hmm.
So I'll know that because I'll see that there's 4s, 5s, and 6s there, and I'm like, well, great, you can floss, but you're only cleaning the top of that pocket, but not the bottom. Which is the bottom is where all the crud sits that destroys your bone.
So it's all about prevention.
Absolutely.
Prevention.
Yes, it is.
And Dr. Aaron, so our program is coming to an end. And before we finish, I really want you to say a few words to our listeners, to our viewers. What would you like to wish them tonight? Your chance.
I mean, I'd like to just say, dentists are not as bad as we come across.
Oh, yes,
I know,
sure.
definitely. I know
Good
it
one
can
to
be
mention.
scary, but the sooner, the faster you face your fears, the fewer problems potentially that you're gonna have. And also just do your research. There's so much out there. Listen to your gut instinct. If something's off, just research it. Get second opinions, third opinions. And again, don't neglect your oral health because the mouth is the gateway to the rest of the body. You're eating, you got a lot of bacteria. It goes into the bloodstream. It goes, you're chewing food, all that you're swallowing. So you need to keep this clean, and there's a better chance that the rest of the body is going to be in better shape.
Absolutely.
Yeah.
By the way, when you do your research on a dentist, you call the office. What are the things that you really should be looking out for? One thing I realized during this program is that you have to ask them what kind of X-ray machines they
Correct.
use. So
Yes.
that's one question.
Mhm.
What else do you have to ask them to determine whether it's the right dentist or not?
Well, so if you have silver fillings in your mouth or amalgam fillings and you want them safely removed, right? You want to ask if the patient if the doctor has what we call SMART certification. That's SMART stands for Safe Mercury Amalgam Removal Technique. So that dentist would have to be certified with the IAOMT, which is that association that I talked about earlier. And so you can ask if they're SMART certified. There's so many questions. I've had people ask what kind of water we use in our office because they want to avoid fluoridated water. So,
Yes.
and I say, yes, we do have a filter because we did that, right away when we were renovating the place. So yes, we have a filter that filters out fluoride. So just today I had somebody call with that question. So there's tons of them. If you do your research, if you look all this up online,
It's
there's
all online.
questionnaires.
There's a whole
that
questionnaire.
you can ask. Yeah.
Thank you so much. So tonight we had Dr. Zina Aaron, a holistic dentist, as our guest. You can find her at the Rose Dental in Tucker, Atlanta.
Yes.
The phone number there is 678-528-6747. Please call to make an appointment with Dr. Zina Aaron. And, I want to join you in your wishes to our crowd. And I also want to say just fall in love with your toothbrush twice a day, 2 minutes
Yes, and
each
floss.
time, and floss.
Yes.
And you'll be happy and healthy. And we are looking forward to seeing you next Thursday at 6 o'clock. Be well.
All right. Bye-bye.
Bye-bye.